In this lesson, we're going to talk about urethritis. Now, what is urethritis? I would say you've guessed right if you said inflammation of the urethra. Like cystitis, it could be infectious or non-infectious type of inflammation. We also know this condition as the pyuria dysuria syndrome. It has a few other names too. Well, let's discuss more about this condition. I would like you to take a look at this question and pause by right-clicking and selecting the pause button, and you can do the same for resume, but I'm going to go ahead and move forward as you read this question. Did you get this answer? I hope so. Let's talk more about it. Urethritis. Most of the cases of urethritis are from STIs, or sexually transmitted infections. The ones I'm thinking of are chlamydia, gonorrhea, and trichomonas. Men report UTI symptoms of suprapubic pain, urgency, dysuria, but they will also have orcalgia, which is feeling of genital heaviness. I do have an example here of what a male patient with urethritis would look like. And there you have it. Now, females will also have symptoms similar to cystitis, but they will have urethral discharge, such as in this picture. To be able to express the discharge, you have to insert your fingers vaginally and push upward for the discharge to come out. And in older women who have urethritis, it's usually related to postmenopausal changes, and we will know that their skin and mucous membranes down there have thinned and become more dry. Therefore, it will be more irritating at the urethra. After reviewing the patient's symptoms, do ask about their STI exposure. Have they had unprotected sex? Ask about their discharge presence with urethral pruritus, otherwise known as itching. Is that present? And do they have dysuria? Patients usually describe it as dull, achy, or burning. When we look at their labs and we do a urinalysis, it will definitely show pyuria, or white blood cells in the urine, but there will not be a lot of bacteria. In fact, probably about less than 3+. We do need to do an endourethral smear for males for a sexually transmitted infection and an endocervical smear for females. That means you probably are going to need a couple of different instruments to be able to complete those tests. If the UA is negative for anything, we are probably going to suspect our patient has interstitial cystitis. However, if we do notice that they have had a previous cystoscopy, which is used to diagnose interstitial cystitis, the provider might decide to do a pelvic exam to look for tissue changes related to menopause. As we move into the treatment for our patient with urethritis, first we need to know if they have an STI, which is likely going to be the case. If that is the case, and they test positive for gonorrhea, we're going to give them ceftriaxone, which is a cephalosporin, which we should also be learning this module, and one of the macrolides, azithromycin. Do you remember anything particularly about the macrolides? Maybe photosensitivity? Maybe that they can be nephrotoxic? If our patient tests positive for chlamydia, another STI, we can possibly give them azithromycin, or we can give them one of the tetracyclines, such as doxycycline. Do you remember if this is a long-acting or a short-acting one? The answer is long-acting. If the patient tests positive for trichomonas, which is a parasite, we can give them metronidazole. This drug is fantastic, and if you remember from our GR lecture, it is used to be given for GI infections as well. And last but not least, if our patient does have urethritis due to low estrogen levels, we can give them a we can give them a topical estrogen cream, which should be applied vaginally. Here's a question for you. Please pause the slideshow. Is this the answer that you got? Well, I hope so, and if you didn't, that's okay. Just be sure to read the question slowly and carefully. That's all I have for this topic of urethritis.